Hi my beauties, welcome back to Younger. Today we're going to be talking about skin myths. So before I move on, I ask that you like, comment, and subscribe and share this video with anyone who may find it useful. So the reason why I wanted to talk about skin myths, because as a board certified dermatologist, it's hard for me because patients come in sometimes with the wrong information, spending money on the wrong products or doing the wrong treatments by the wrong people, and not only wasting their money and time, but they're also sometimes having bad outcomes or having harmful effects on their skin. So in this day and age, it's hard for me as a dermatologist because as a physician, I've taken a Hippocratic oath to do no harm and to protect people and protect their well-being and their overall health. And as a dermatologist, that means skin health. But then on the other hand, when I see things that are on the internet or Instagram advertisement for skin products that not only don't work and waste your money, but can be harmful for the skin, I feel like a moral obligation to protect you guys meaning my followers, my patients, my loved ones, from using products that may not work and may be harmful. But at the same time, I'm a nice person and don't want to bash a company or say anything mean about anyone or insult anybody's credentials. But it's a very delicate balance. In today's world, it's interesting because I feel a balance between protecting you guys, but then also not bashing any companies or skincare lines that may not work. So the reason why I wanted to talk about these skincare myths or skin myths is because hopefully by watching this video, you'll at least learn 10 or so facts that may protect you from making bad decisions or buying the wrong skincare product or doing the wrong treatment that can harm you. So the first myth that I wanted to talk about is why oils or moisturization is bad for your skin. I know I feel like I've beaten this topic to death, but it's a really hard concept for people to get a hold of. And using oil on our skin, if you want to learn more about this, you can watch my previous episodes on why moisturization and oil can be bad for the skin. But basically, to summarize it, when you put oil on your skin, it feels good because your hands that are touching your skin and the oil sitting on the surface of the skin feels good. But what it does is it doesn't hydrate your skin. It doesn't stimulate your skin cells, which we call the keratinocytes, to hold on to water and to hydrate. And so without stimulating the underlying structures of the skin to behave healthy and behave younger, increase cellular renewal, increase collagen and elastin synthesis, you're basically doing your skin harm, because although the oil may feel nice as a texture, maybe smell nice, or the packaging may be pretty, it's doing nothing for your skin. You have to stimulate your body to hydrate from within. Again, I don't want to go through this further. Just go ahead and watch my other video on moisturization and oils. There's 2 parts to that topic, and hopefully that'll answer any questions that you have. The second myth I wanted to make clear is that washing your face is bad. That's what people have said to me. Sometimes patients come in the office, they're like, I don't wash my face, or I just wash my face with water. I just want to go, oh man, what are you doing? You have to wash your face, you guys. Morning and night, you have to wash all the dirt, oil, debris, sebum, everything that sits on the surface of the skin at least twice a day. If you can do an exfoliating scrub at least once a day, that's even better. So every time you wash your skin, not only do you remove the impurities that collect through the day, if you park your car outside and in the morning and say your car's clean and you kind of swipe your finger across the window, it's going to have dirt and debris on it. Same as your skin. You're walking around, you're at the gym, you're at work, you're encountering people, there's aerosolized, airborne microorganisms everywhere. You have to clean your skin every day and night. And not only does that remove all the dirt, oil, makeup, debris, sweat, sebum, all that bad stuff, but it allows your skin to breathe, and it allows that dead skin cell layer, which is called the stratum corneum on the very surface of the epidermis, to be desquamated off, to kind of get scrubbed off, which stimulates the newer baby stem cells at the bottom of the epidermis to proliferate and make new cells, make new skin cells. So it basically increases cellular growth, increases cellular renewal, so you're shedding all the bad icky skin and you're making new healthy younger skin cells every day. So that's a really important concept. And also, when you leave dirt, oil, and makeup and debris on your face, it accelerated premature aging because it causes inflammation, congestion of your pores, and it's just bad for your skin. So you guys have to wash your face at least twice a day. And no matter how beat dead or tired you are, at the end of the day, at the end of the night, I know I have 2 kids too, and you have kids and you have a job and you have a career and you're wearing multiple hats, you have to take that time for yourself, because this is the only skin that you're in and you're going to have it for your entire life, and it's the first thing that people see when they meet you, when they talk to you, so you have to take good care of it. So make sure that you wash your skin every night before bed, no matter how tired you are. Okay, so the third skin myth, what and I think about, okay, Retin-A thins your skin. A lot of patients come in saying, I'm afraid to use a Retin-A or a retinol or retinoic acid because I don't want my skin to thin. So they've done extensive research and studies on these, a lot of FDA randomized controlled trials, and there's overwhelming data and evidence from a scientific peer-reviewed literature that doctors go by that basically Retin-A, when used, appropriately, does not thin the skin. The only time the research has shown to thin the skin is when Fitzpatrick type 1 patients, which are very, very light, fair-skinned patient populations with little to no pigmentation. This is usually Scandinavian descent, blonde hair, blue eyes, very little pigmentation in their skin. When they use Retin-A in high doses at very high potencies and strengths continuously for like 5 to 7 years, it can thin the epidermis. But usually that's a very small percentage of the worldwide population, and also when dermatologists prescribe tretinoin or retinoic acid or Retin-A, which is only prescription based in the US, it's usually given at an appropriate not only strength but vehicle. So it could be a 0.02%, 0.05%, a 0.1%. It can be a gel, a microemulsion, it could be a lotion, a cream. So it just depends on the potency. And when you vary that up, that's why I always say mix up your skincare regimen. You guys know that I change my skincare regimen every month. I kind of rotate through different lines and different brands, and I actually change my Retin-A. Right now I'm using Refisa tretinoin 0.05%. But you'd switch it up, and that prevents that thinning of the skin phenomenon from happening. And if you're not even of the skin type, it's called Fitzpatrick type 1 skin, you don't even have to worry about it in the first place. So moving along, the other myth I wanted to kind of clarify for everyone is hydroquinone. So hydroquinone is a lightening, brightening agent that basically was banned in the UK for other reasons. So patients, as a dermatologist, when they come in and they're afraid for hydroquinone, it's one of the best tools in our armamentarium that we have to lighten really stubborn melasma that may be superficial and deep, to lighten post-inflammatory hyperpigmentation, to lighten ephelids, what dermatologists call freckles, or you guys call freckles, we call them ephelids, lentigines, which are sunspots or those brown spots that you get from the sun, to just kind of even out the tone, which is the pigmentation of the skin. Hydroquinones are necessary and a really great medication that we use, and we usually don't use it for more than 3 months. People with really recalcitrant or stubborn melasma will use it 3 months on, 3 months off, or they'll use it for 6 months out of the year and then take a break in the winter or in the summer. So every dermatologist has their own protocol and algorithm that they follow for patients who are with dyspigmentation or melasma, and as long as you're doing it with the aid of you're getting a prescription from a doctor who's seeing you regularly, then you don't have to worry about any of the deleterious effects of hydroquinone. And in Europe and in UK, it was banned. There were some studies that lab animals were ingesting large quantities of hydroquinone over the course of years, and there was some side effects with it, but less than 1% of the hydroquinone that's applied to the skin is absorbed systemically, so you don't have to worry about that. The real reason, the only thing you really do have to worry about hydroquinone with prolonged use is not any medical side effects, but basically a phenomenon called ochronosis. Ochronosis is when the hydroquinone molecule kind of discolors the skin. So paradoxically, when you use hydroquinone to treat brown spots, it actually causes darkening from the hydroquinone. But that only happens if you're using like 6 to 8%. I usually prescribe 4%. Most dermatologists do, but if you're using like 6 to 8% over a prolonged period of time for years, then that could be a potential side effect. But don't even worry about that. Leave that to us, the dermatologists who are board certified and go through 10 years of school just to learn the skin on a level that very few have. Take it from us. We do no harm, and we would protect you from anything bad happening to you. So hydroquinone, don't worry about using hydroquinone. It's safe when used appropriately. So other things I wanted to speak the truth about. So basically, patients sometimes think that after having Botox treatment, they have to make facial expressions for the Botox to kick in faster. That's kind of old school. They've done a lot of research and data, and usually when patients have Botox, we just say to kind of just chill for about an hour after injection. I tell my patients, don't go lay down face forward like in a massage chair or anything like that, or go work out for about an hour. I just have you be mellow for about an hour, and then after that, go ahead and resume your daily activities. You don't have to worry about making the facial expressions anymore. Another myth that's not true is that Botox can take your baseline worse than when you started. So this comes into play a lot when my younger patients, in their 20s, start having forehead lines or crow's feet, and they want to jump on it early and be preventative. I'm all about that, you guys. This is like 2019, we need to like move forward and be more proactive, not reactive. It's not the days anymore where we don't do anything or we don't have anything available. You get old and wrinkled and then you try to rewind the clock. It's easier to prevent it. Prevention is key. Once they form and you do Botox, you can erase those lines, but it's better to prevent them before they even occur. Now, I'm not saying start, you know, too early, but I mean, everybody's different. People will ask me, how young is your youngest patient that gets Botox? It just depends on the individual. If I have a 22-year-old that's going to have etched in forehead lines for the rest of her life, I'm going to put a little bit of Botox in there and protect her from that happening. Not everybody has that. Everybody ages differently depending on your ethnicity, your ultraviolet light exposure, and you know, your genetics. So if someone's having early crow's feet, we use Botox to prevent them. And if you ever stop, it's not like you'll go back to being worse than the first day you had the Botox. So you'll never be worse off than you were before if you start Botox. So that's an untrue myth that's out there as well. Same thing with filler. Patients are sometimes worried about getting filler because they don't want to become dependent on it. I always talk about the J-Lo path. J-Lo has looked the same for 30 years and she looks so good, and she doesn't look different, she looks the same. And that's because anytime there's any little change or any little sign of aging, she jumps on it, and she's been on it for the past probably 30 years. Any little change that happens, volume loss, fine line, wrinkle, anything, brown spot, she's on it. And she has continued to be proactive, not reactive, and that's why she looks so amazing. So I always talk about, you know, fillers and Botox. Don't worry about starting it, because what you should worry about is getting it when you don't need it. If you need it or if there's an indication, you know, I'm very methodical with the way I, you know, prescribe or recommend treatments for patients. If somebody's having a little bit of volume loss in some area, then we attack that. Sometimes people have volume loss here first. Sometimes they have it in the marionette lines first. Sometimes it's nasolabial fold. Sometimes it's sunken tear troughs. So everyone has their little thing that they have and their way that they're going to age. You can look at your parents and grandparents and say, okay, that's what I'm going to look like. I need to make sure that that doesn't happen, and jump on it. And so don't worry about being worse off than you were before starting a treatment. The other myth that I wanted to clarify is that sometimes patients are worried about lasers causing things like skin cancer or scarring. This is true. If you go to someone who is untrained or a non-laser expert, scarring and post-inflammatory hyperpigmentation is a risk. But if you go to somebody who's fellowship trained and very well trained in lasers and devices, this isn't going to be an issue. Even with darker skin types or Asian skin, you have to be careful with lasers, but selecting the right wavelength, the right settings, the right laser, and pre and post treating them appropriately with skincare products to make sure that that doesn't happen is key. And it's not something you don't have to worry about post-inflammatory hyperpigmentation or discoloration or scarring when you're going to someone who's highly trained. So that's why I always say look up the credentials of those who are treating you. And lasers, especially like Fraxel and resurfacing lasers, can be anti-cancer. They prevent skin cancer from happening. So not only do they have anti-aging benefits, but actinic keratoses or little precancerous growths that we get have been cleared with using lasers. So resurfacing not only makes your skin look better and fights the aging process, but it's healthier for your skin, and it significantly decreases the risk of cancer and precancerous lesion. And I'm a Mohs micrographic surgeon. I'm a skin cancer surgeon. So this isn't something like I read online. Like after a dermatology residency, board certification, and 2 fellowships and surgical fellowship, this is something that I know and I can guarantee you that is the truth. So don't worry about what you're seeing out there online. There's a lot of noise. There's a lot of people who may not have had the training and read something somewhere and just want to blog about it. There's no accountability. There's no checks and balances out there. And there's a lot of noise out there of myths that are not true. So I want to protect you from that. I'm trying to think of something else that I may be forgetting. Somebody had recently commented on my last YouTube episode on reducing pore size about some beauty bloggers talking about the acid mantle. Okay, so this is another point where as a doctor I need to protect you guys and let you know the truth, but I also don't want to say anything negative about anybody else or any other company or any other bloggers. But like I said, as a dermatologist, we have to know skin on a molecular level. I mean, the things that ask any dermatologist to be board certified in dermatology, I mean, you have to know how many kilodaltons bullous pemphigoid antigen 2 is. You have to know the molecular structures, the dermal epidermal junction, the cellular proteins, the molecular configurations of every protein, every molecule, every aspect of the skin. So for some blogger to say that there's an acid mantle made up of, you know, esters and waxes, and that using skin acids and certain products is going to disrupt that and cause inflammation. And you guys don't worry about that. There's no acid mantle. First of all, there is no acid mantle of the skin. Otherwise, we would have been tested on it on our boards and we would see it under the microscope. I look under the microscope once a week at skin, and there's no such thing as an acid mantle. So don't get tripped up on that. Using different alpha hydroxy acids and retinoic acids can be helpful for the skin. Of course, there's bad acids as well, but as long as you're using a reputable medical grade skin line or something that's being given to you by a dermatologist, you guys are safe. So don't worry about it. I don't want you to think things that are true that are actually not and can actually harm your skin. So there's a lot of talk out there also about using essential oils and natural products on your skin. Just because something is natural or vegan, it doesn't mean that it's safe or healthy. I mean, poison ivy is natural and occurs in nature, and if you rub it on your face, you're going to go into anaphylactic shock and be miserable and have to go to the ER and get a Medrol dose pack and be hospitalized. So just don't worry about it. Things like limonene and tea tree oil, sometimes patients benefit from it, but there's also, it can be highly inflammatory, contact irritant dermatitis, antigen. It could cause some harm to your skin as well. I mean, I remember for my dermatology boards, we had to, I think there was like 825 of the most common contact irritants and allergens and antigens, and they were all pretty much natural products. Just because you're buying a natural product doesn't always mean it's safe, doesn't mean it's going to work, and it shouldn't take the opportunity of something that actually could benefit your skin and could be working. And I just want to make sure that you guys are just well aware of the active ingredients that do work in these products and ones that you want to stay away from. So a lot of you asked me to just list products and list skincare lines that I like. I don't want to do that either, because my job is just to empower you guys and give you guys the truth and evidence that's backed by years of science and data and research, and skin biopsies are actually showing changes, patient results that are talked about at our academy meetings by colleagues, and patients' results that I see firsthand. So I don't want to just simply list products. I want to list active ingredients and the mechanisms for devices and how they work, so that I can educate you. So I'm not selling you anything. I'm not affiliated with any company, and I'm not paid by any or endorsed by any company. I just want to give you guys the tools, because I'm super passionate about this, if you can't tell. I want to give you guys the tools to know what active ingredients work, what's right for your skin type, may be different than what's right for mine or for someone else's. So hopefully, just by talking about some of these skin myths, I have kind of guided you and kept you on track, because of all this kind of sometimes nonsense that's online or on the internet. I want to kind of keep you guys safe and protective, and this is like a safe haven for you guys to check in and ask me questions. I'll get back to you as soon as I can. I'm usually seeing patients all throughout the day, but I try to get back to my comments as fast as I can, and I love that you guys are as passionate about skincare as I am. Thanks, and hope this helps.